Welcome, my lady garden holders, to lesson 102 in Lady Garden Horticulture. Freaking hormones, HRT, dementia, cardiovascular disease, metabolic disease, bone loss, osteoporosis, perimenopausal psychosis. You're welcome. I know you're all hanging out for my lesson in vaginas, but we pushed hormones forward because it could be a lifesaver. There is so much misinformation floating about, and ladies, we are searching for help. Some women commit suicide. This is how truly effed up perimenopause can get for some. And in their plight for answers, they are met with misinformation and a freaking script for antidepressants. So let's talk hormones. But first, I want to introduce you to cells. I know you're all going, what the F? Isn't this talk on hormones? I didn't sign up for a freaking biology class, but I want to very quickly lay some foundations because, my lady garden holders, you will better understand why the decline of our sex hormones has such a profound effect on our body. The cell. So basically they are everything. They make up our entire bodies. Everything within us are cells. It's all cells. And what feeds those cells? The mitochondria. The mitochondria are the powerhouse of cells, responsible for generating energy through cellular respiration. I know, long words, who knows what the F they mean, but basically they are converting chemical energy from food into ATP, the cell's energy currency. Mitochondria possesses crucial roles in cell maintenance, survival, and well-being. Mitochondrial dysfunction is one of the hallmarks of ovarian aging. And what do our mitochondria need? Estrogen. And what declines during perimenopause and menopause? Estrogen. It affects all of our cells, our entire freaking body. It's not just hot flushes and night sweats. And if you do have those, you're actually at a higher chance of cardiovascular disease and Alzheimer's. Go freaking figure. They really aren't just hot flushes. So cells are our entire body. The mitochondria enables them to live, and what needs estrogen? The mitochondria. And if you get hot flushes and night sweats, you're at higher risk of cardiovascular disease, Alzheimer's. And this is only the 1 minute opening. I know, what the fuck is to come, ladies? Let's touch on macrophages. I know, we want to talk hormones. I promise, I'm laying groundwork. Macrophages. I'm putting this really simple. They are cells that gobble up things that are foreign or not good for us, like infections. They come, they eat up the bad cells, and they also produce cytokines, chemicals that help kill anything that's not good and help to reduce inflammation. However, macrophages' function changes based on how much estradiol one has. According to Dr. Louise Newstead, when we have low estradiol levels, it primes our macrophages to be pro-inflammatory. This is why it's thought that women are more likely to have autoimmune diseases. And when estrogen leaves, stress hormones such as cortisol and other pro-inflammatory hormones become more active and destructive. This event establishes an internal trend towards chronic systematic inflammation. It's affecting everything. The peri-party and menopause increases our risk and our chances of cardiovascular disease, dementia, metabolic disorder, loss of bone, osteoporosis, suicide increases, and that's just the icing on the cake. And this, ladies, brings us to hormones. Today, I'm going to focus on next stage hormones, the happy ones that hit us in our late 30s, 40s, 50s, and when a whole new normal starts to approach. Perimenopause, the peri-party, the party you didn't freaking want an invite to. Ladies, this can last 10 to 15 years. And then you go through menopause, which is just defined as 1 day, 12 months after your last period. Then you're in postmenopause, and symptoms again can last 10 to 15 years. That can be up to 25 years, almost a third of our lives. And yet this period of time has been under-researched, under-acknowledged, underfunded, and very much misunderstood. So in a nutshell, we have 30 to 40 years of no real understanding of what the heck is going on with our bodies. We just wing it from, say, 11 or 12. And then we have another 10 to 15 years of manic hormones, feelings of despair as we lose our monthly friends, the friend we didn't want in the first place, but now we don't want to lose. And during this time, our risk of cardiovascular disease, dementia, metabolic disorder, osteoporosis increases by almost 30% due to the decrease of estradiol, which is cardio and neuroprotective. Life as a woman just keeps on giving, doesn't it? Did you know that? And what is even more alarming is that every organ in our body has estrogen receptors. Think of the cells I mentioned above. Let that sink in, especially when you're facing not having any or very little for the rest of your life. Am I scaring you yet? So why, you ask, why do we lose estrogen? Estrogen is primarily made in the ovaries, and when those little bad boys dry on up and have no more eggs, that means limited estrogen. More importantly, estradiol. There are 3 types of estrogen in our body, and I've taken this information from Dr. Mary Claire Haver's book. She is the goddess to women going through the hormonal transition. Grab her book, The New Menopause, or listen to her podcast. She is a wealth of information. I will be referencing Dr. Harver, Dr. von der Wright, and the hilarious Dr. Casperton frequently, so do follow them. Estradiol. This is the superstar of estrogen family. It's the primary form of estrogen made by our ovaries during those years when we are in our reproductive prime. Think of it as the Beyonce, it's the Taylor of hormones. It's the most biological, active, and powerful form of estrogen. So when someone says estrogen, they're generally talking about estradiol. When menopause hits and estradiol says, no, I'm out, its production practically disappears. So your ovaries go on vacation and estradiol, it taps out. Next, we have estriol. This one is the pregnancy superstar. Estriol is mainly made by the placenta during pregnancy, which means if you're not growing a tiny human inside you, estriol is basically a ghost hormone, undetected and just hanging out. However, even at low levels, estriol can still have a little bit of an impact on bone health and metabolism. So it's not a total slacker, but it's definitely not on the main stage. Now let's talk about the weaker estrogen, estrone. Think of estrone like the backup dancer of estrogen world. During menopause, when your ovaries start cutting back on estrogen production, the adrenal glands get involved. They release a substance that your fat tissue turns into estrone. Yes, your fat is actually helping you out here. Estrone becomes a more prominent form of estrogen after menopause. It helps with some bone maintenance and tissue repair, but it is no estradiol, that's for sure. And now here is where things get interesting. There is some chatter that the increased visceral fat, which is around our belly generally, could be linked to this very process. The theory is that your adrenal glands release more of the substance for your fat to turn into estrone. Your waistline might just expand to help with this transition. The jury's still out on this one, so we need more research, which begs the question, are we really growing muffin tops to make sure that we've got enough estrone in our system now that estradiol is MIA? So let's recap. Estradiol is the powerhouse and it fucks off during perimenopause and menopause. Estriol is in pregnancy and estrone is doing its best to step up after menopause. But let's face it, it's not exactly winning any awards. And that's the lowdown on estrogen. And it's not just estrogen that goes down. Our ability to produce testosterone and progesterone also diminishes. Progesterone is a hormone produced by the ovaries that helps regulate the menstrual cycle and plays a crucial role in preparing the body for pregnancy. It works in tandem with estrogen to maintain a balance in the reproductive system and get your body ready for pregnancy. Just in case you want to get in and make another tiny human still. It's like estrogen's bestie. They work together to keep everything running smoothly in the reproductive system. But as we approach the gates of perimenopause or the peri-party, progesterone production drops faster than your enthusiasm for a 5 a.m. gym workout. And here's what happens when progesterone checks out. Irregular periods. Thanks to progesterone, periods might come and go like an unreliable friend. Sometimes heavier, sometimes lighter. They're just gone for a while, and then surprise, they show up 6 months later. Shorter luteal phase. The luteal phase is that cozy time after ovulation where your body hopes you're pregnant. With lower progesterone, this phase shortens and gets quite chaotic. Irregular bleeding, conception struggles, the drop in progesterone combined with estrogen doing its own thing, it's like a thermostat that's just given up. 1 minute you're chilly and the next you're in the middle of a full-blown sauna. Mood changes. Your mood can turn into a circus. Irritability, check. Anxiousness, oh yeah. Feeling like you can throw a tantrum? Abso-freaking-lutely. Sleep disturbances. Thanks to the low progesterone, your sleep quality is about as good as a Netflix series that keeps on buffering. Insomnia. Yep, that is now a thing. I had progesterone last night. Well, actually, it was a couple of nights ago, but I wrote this a few days ago. And I called my girlfriend and I said, fuck, I had forgotten what it was like to sleep. How good is freaking sleep? Increased risk of endometrial hyperplasia. Without progesterone keeping estrogen in check, your uterine lining might thicken. And if this gets out of hand, it could lead to serious issues like endometrial cancer. So basically, progesterone's job is to keep estrogen from going on a rampage. And when it dips out, you can end up with a hormonal mess that has you feeling like your body's throwing a party and it forgot to invite you. And then there is testosterone. Wait, isn't that a man's hormone? Nope. Turns out we need testosterone too. Testosterone's got your back when it comes to energy, libido, muscle mass, and bone density. And here's the twist. Testosterone is produced by the ovaries, adrenal glands, and peripheral tissue. But as we approach the peri-party, testosterone levels start to drop faster than your phone battery during a Zoom meeting. But wait, there's more. Testosterone's got a side gig. It helps convert estriol. This magical transformation is key for both bone health and keeping your mood from doing backflips. So when your testosterone dips, it's like a domino effect that also messes with your estrogen levels. And here's what happens when this stallion bolts the stable. Low testosterone levels may cause changes in breast tissue, fertility problems, low sex drive, missed or irregular menstrual periods, osteoporosis, vaginal dryness, fatigue, decreased libido, muscle loss, and of course, the occasional mood swing that could rival a roller coaster. And on the flip side, if there's too much stallion in the stable, high testosterone levels may lead to acne, blood sugar problems, excessive hair growth, usually on the face, infertility, lack of menstruation, obesity, and PCOS. And the symptoms of these diminishing hormones are not just hot flushes and night sweats. Oh no. It is a whole lot more, ladies. A whole lot more. Get ready to be blown away by the perimenopausal symptoms. We are talking acid reflux, acne. Yes, turns out breakouts are just as much of a part of perimenopause as they were when you were 16. However, we now need a magnifying mirror to pop them, but don't pop them. We don't want scarring, especially when we have older skin, trust me. Alcohol intolerance, anxiety, joint pain, arthritis, asthma, autoimmune diseases. How many of you have gone to the doctors with sore joints and they're testing you for rheumatoid arthritis and a list of other things and they can't find anything wrong? Bloating, body composition changes, and belly fat. Is this the body trying to make estrone by growing a frickin' muffin top? Brain fog. Who else is forgetting major things at work, like the name of things? Can you pass me that thingy, that I don't know, that thing over there? It's a pair of scissors. Brittle nails, breast tenderness, burning sensation of the mouth and tongue, chronic fatigue syndrome. Who is freaking tired? Hands up. Crawling skin sensation, decreased desire for sex. This is definitely, it's not you, it's me scenario. So husbands, listen up. Dental problems, depression, difficulty concentrating, dizzy spells, vertigo, dry or itchy eyes, a dry mouth, dry skin. I see this in my clinic all the time. Eczema, electric shock sensation, genitourinary symptoms. I mean, what the fuck does that actually mean? Basically, everything that involves your pelvis. High cholesterol. I was just at a talk and Michelle Bridges, one of Australia's leading fitness figures, says she suffers from high cholesterol. She shouldn't get high cholesterol. Look at her. She is a health machine. Hot flushes, incontinence. Have a think about this, ladies. If you are still getting your period and you are finding the week before your period you're needing to pee like every 5 seconds and dashing with urgency to the toilet, I know I am, this is because our estrogen generally tanks the week before your period. And now that we are 40 plus, it's decreasing more than it used to when we were younger. And your genitourinary system and everything in your pelvis, it freaking loves estrogen. So it tanks too. Insulin resistance. This can lead to a whole range of metabolic disorders that we'll get into. Kidney stones, memory issues. I am constantly walking aimlessly around my house. By the time I've got to one end, I'm walking back trying to figure out why the heck I'm in the laundry and not my bedroom. Changes in menstruation, shorter or longer. Mental health disorders. Our risk of suicide increases. Considering for women, our risk of suicide increases in our teens, post-pregnancy, and then again at the age of 40 to 55, I'm seeing a pretty big correlation here with hormones. Did you know that post-pregnancy, your body goes into a mini menopause and your estrogen crashes, which allows us to breastfeed? There is mounting evidence to suggest that the fluctuations in estrogen can significantly influence the risk of depression. Think postpartum depression. Then there's perimenopausal psychosis, migraines, mood changes, muscle aches, night sweats, non-alcoholic fatty liver disease, osteoporosis, pain with intercourse, loss of estrogen gain, skin around our vagina becomes dry and thinner, muscle loss, sleep apnea, sleep disturbances. Who the F keeps waking up at 2 a.m.? Progesterone, please. Thinning hair, thinning skin, tendinitis, which is ringing in the ears, TMJ, locked jaw, unwanted hair growth, urinary tract infections, and this is big. 5 to 7% of sepsis arises from UTIs, and 270,000 people die from sepsis in America and 8,700 in Australia, which is more than stroke and road accidents. Did you know that vaginal estrogen has almost an 80% success rate in preventing reoccurring UTIs? But let's give low-dose antibiotics. I had a UTI recently. I actually had it for a few weeks and I thought it was something else. I persevered with the pain and the constant need to go to the bathroom for weeks until I started to get some sweats. For weeks, I rode this out, and it's pretty sad that I didn't actually pick up on it, and I was also trying to avoid antibiotics. To my point, it's so easy for something so simple to become worse, especially as we age. We will hear about one of my friends' scares with UTI and sepsis in upcoming episodes. Then we have vaginal dryness, vertigo, weight gain, and of course, wrinkles, jowls, and saggy skin. Understand too, these sneak up on us. We have to think back to our 20s, our 30s, and compare ourselves to now. No, it's not that we have kids and we are tired and we can't be bothered with sex, or actually we just can't be bothered with life itself. Really, you have to think about it. What has changed? Are you experiencing any of these symptoms that you had before, but they're worse? Or maybe you're experiencing some of these symptoms and you've never had them. Hormones really are the life force of our existence. And when they are out of whack, sure do we know about it. Yet, isn't it wildly disappointing that the medical system is only now just figuring out that all of these symptoms are perimenopause? In the famous words of Kelly Casperdom, if a man was told at 52 his penis would drop off, it would be a pandemic. It would be COVID all over again. Every scientist would be working on it. billions would be spent, and then there would be a pill for it. But we are expected to suffer. It's normal. It's all in our heads. You are too young for perimenopause. And what's even more shocking, when we go to find answers, we are met with a medical system that is letting us down. Recently, a friend of mine who was experiencing night sweats and sleeplessness was told by her GP that she was too young to be perimenopausal. What the F? She's freaking 48. You can start experiencing perimenopausal symptoms at 35, and the average age of menopause is 52. So she's 4 years off the average age, and yet the perimenopausal journey can last 7 to 15 years prior to menopause. And menopause is just one day, 12 months after your last period, and then you're postmenopausal. And her GP is telling her she's not perimenopausal? What the F? Just take into consideration egg cell count. For example, on average, at the age of 30, we have 10% of our egg count left. At 40, that is 4%. Our bodies are on the downward trajectory. How is the medical system so misinformed? And why, honestly, does this all matter? Picture this. And for some of us, we don't need to picture it because we've probably lived it. We visit our doctor, we've got frozen shoulder or joint pain, and we walk away with cortisone injections and pain relief. We're also anxious, so now we have anti-anxiety medication. We are bouncing between high and low moods, so here is some antidepressants. And our cholesterol is up, so here's some statins. And unexplained itchy skin and weird tingling? Here's a referral to a dermatologist and a neurologist, plus a note to take some magnesium. And for the heart palpitations, here's a referral to a cardiologist. So we've gone to the doctor for frozen shoulder or sore joints, and we've walked away with cortisone injections, 3 scripts for medications, 3 referrals to a specialist, and a suggestion for supplements. But what about all the doctors that are alleging supplements don't work? It's a shitstorm. And we can't remember what the doctor said because now our brains are mush and we have convinced ourselves we have early fucking onset Alzheimer's. And let's explore Alzheimer's, dementia, metabolic disorders, bone health, suicide, and our increased risk as we enter the peri party. But before I do, I want to touch on the WHI study. The study that led us to believe that HRT causes cancer. Why do I want to touch on this? Because recent research is suggesting that many of the diseases mentioned above are shown to decrease with the use of HRT. So let's clear a few things up. Before the WHI study, did you know that by 1990, 38% of women aged 50 to 65 were taking hormone replacement? These have been mostly observational studies from this time, but it's suggesting that women on hormone therapy had a decreased risk of coronary artery disease, a lower risk of neurodegenerative disease like dementia and Alzheimer's, as well as a reduction in colon cancer and osteoporosis-related fractures. In 2002, the media went wild as news broke that HRT could cause breast cancer. The study was stopped and women all over the world were denied their hormones. But for what? According to the book The New Menopause by Dr. Mary Claire Harver, the study is fraught with misinterpretation. The WHI study suggested that the increase in breast cancer was 25%. The risk of someone developing cancer in the placebo group, the people not receiving HRT, was 4 in 1,000. These are the people not taking HRT. Whereas the risk in the group receiving progesterone and estrogen rose to 5 in 1,000. This was calculated as a relative risk increase of 25%, so from 4 in 1,000 to 5 in 1,000. However, the absolute risk of developing breast cancer was actually only an increase of 0.08%. Yet the risk of getting breast cancer today has risen, and Alzheimer's is set to be the leading cause of death in Australia. Go figure, we're not taking hormones. In 2022, the Menopause Society issued a statement on their website emphasizing the absolute risk is more useful for conveying risk and benefits in clinical settings. They also stressed the need for healthcare professionals caring for menopausal individuals to understand the basic concept of relative and absolute risk in order to communicate the potential benefits and risks of hormone therapies and other therapies more effectively. Also, since this study, the delivery mechanisms have changed. Think transepidermal estrogen applied to the skin, and the introduction of bioidentical hormones has also been a game changer in the field. It's not the same hormones or delivery route that was studied in the WHI study. In fact, it's even better now. And let's talk Alzheimer's and dementia. As we know, estrogen drops significantly during menopause and plays a crucial role in brain health. It's neuroprotective, which means it keeps your brain sharp. Estrogen helps support brain plasticity, boosts memory, and helps fight off inflammation. But when estrogen drops, we might notice our brain function doing a little disappearing act. Poof! Suddenly, we're not remembering where we parked the freaking car. Women are twice as likely to develop Alzheimer's than men, which has long been attributed to the fact that women live longer than men. And the risk of Alzheimer's increases as we age. But emerging research has found that the dramatic change in hormones we are experiencing during the menopausal transition, especially the loss of estrogen, can increase neuroinflammation, according to the neuroscientist Dr. Lisa Mosconi, who is the Associate Professor of Neuroscience, Neurology and Radiology and the Director of Alzheimer's Prevention Program at Weill Cornell Medicine, New York. She believes this could also be the reason as to why we are disproportionately affected by other cognitive-related diseases and disorders too, such as MS and autoimmune diseases, migraines, and major depressive disorders. So what do we do here? Recent studies, including those led by Dr. Mosconi, suggest that initiating hormone replacement therapy soon after menopause may reduce the risk of developing dementia and Alzheimer's. One study found that starting estrogen therapy within 10 years of menopause was associated with a 32% reduction in dementia risk. 32%. Some scientists like to talk about the critical window hypothesis, which is a fancy way of saying timing is everything. If you start HRT around the time of menopause, it might help keep your brain functioning at full speed. But wait too long and it might not have the same positive effects when you started earlier. This is still being researched. And then let's talk about the APO4 gene, which is the Alzheimer's gene. We know that our risk of Alzheimer's and dementia increases as the perimenopausal party starts to wind up, especially if we are carrying this genetic little party favor. The APO4 gene is one of the strongest genetic risk factors for Alzheimer's. Individuals who inherit one copy of the APO4 gene from one parent have an increased risk of Alzheimer's, and those who inherit two copies, one from each parent, have an even greater risk of Alzheimer's and dementia. Dr. Mosconi's research, along with others, has emphasized that women, particularly those in perimenopause or postmenopause, are at greater risk of cognitive decline and Alzheimer's if they carry the APO4 gene. One key finding in Dr. Mosconi's research is that estrogen may offer protection against the damage caused by the APO4 gene. Dr. Mosconi suggests that starting HRT around the time of menopause and perimenopause could be crucial in mitigating the risk of Alzheimer's and dementia, particularly for women who carry this gene. Estrogen may play a significant role in reducing the buildup of amyloid plaque, a hallmark of Alzheimer's disease, and help protect brain cells from degeneration. While much of this research is ongoing, Dr. Mosconi and others in the field are calling for more studies to understand how HRT treatments can specifically help women with the APO4 gene avoid cognitive decline. Some studies also explore how lifestyle factors such as diet, exercise, and sleep impact Alzheimer's risk. This is really important for me as I carry one of the APO4 genes. And if you've listened to my previous podcast, you'll know that my mother, who is only 75, is in a home with dementia. And it makes me think, had she not been told that HRT caused breast cancer, and had she decided to go down the route of HRT, would she be in a different place right now? It's pretty sad to think that something so simple could have had such a profound effect on the rest of her life. It angers me that the misinformation that was published all those years ago caused so much harm. I know for a fact my mother struggled through menopause. It was right after menopause that she started to feel something wasn't right cognitively. She also never explored HRT because she believed it caused breast cancer. And it's so sad to think that she declined a treatment for something that she wasn't at risk for, yet it could have helped her with a disease that she was at risk for. She had always worried about dementia, and this may have been a game changer for her and many women like her. Losing a parent is heartbreaking, but losing a parent to dementia, it's freaking soul destroying. If I can avoid my children and my husband going through what I'm going through, what my family is going through, what my father is going through, I would do anything in my power to make this happen. If you're interested in this topic, definitely check out Dr. Lisa Mosconi's book, The Menopausal Brain and the XX Brain, the groundbreaking science empowering women to maximize cognitive health and prevent Alzheimer's disease. Or listen to one of the many podcasts she's featured on. And stay tuned. My goal is to definitely interview her here. And now we have coronary artery disease. It's another factor that we have to keep an eye on when our estrogen decides to take retirement. It's the leading cause of death in women, although in Australia, Alzheimer's and dementia are ready to steal the spotlight. The risk of developing cardiovascular disease increases at around the age of 55, the timing of menopause. That's no coincidence. Menopause comes in like a freaking wrecking ball, raising cholesterol, LDL, and triglycerides, which are basically the VIP pass to heart disease. When progesterone takes its leave, blood vessels tighten up. The liver, confused and stressed from menopause, starts overproducing clotting proteins, and suddenly we're all at high risk for blood clots. And the endothelial cell lining of our blood vessels produce less of the hormone that helps your vascular system relax and allows for blood flow. Now, if you went through perimenopause before the age of 45, congratulations. We are at higher risk of heart disease. And even more fun, if we've had surgical menopause or suffered through hot flushes and night sweats that make us feel like we're a walking lava lamp, our risk is even greater. And here's the kicker, coronary artery disease doesn't throw a party until it's too late. There aren't really any obvious symptoms until something big happens, like a rupture or a blockage that's severe enough to block blood flow. And there isn't really any screening for it either. One of the better tests is the coronary calcium score, which is a CT scan that looks at the level of calcium buildup in arteries. The calcium scoring can reveal the presence of coronary artery disease. And apparently, because we never bothered testing medication on women before 1993, shocking, right? Statins, those trusty cholesterol medications that lower our cholesterol levels and reduce the risk of cardiovascular events like heart attacks and stroke, don't exactly have the same heart life-saving superpowers in women as they do men. Studies suggest that statins may not provide the same level of protection for women, particularly when it comes to preventing heart attacks. Go figure. We are different. As women, we live a third of our lives post-menopause, and we may be living longer. But the real question is, do we live it in better health? Go to any nursing home and you'll notice the ratio of women to men is often higher. We are living longer, but without the benefits of estrogen, progesterone, testosterone, we aren't necessarily living better. Look at osteoporosis, for example. We basically chew up and build new bone every day. The bone you were born with is not the bone you have now. And this is thanks to two cells, osteoclast cells and osteoblast cells. So osteoblast cells break down or eat bone, while osteoclast cells build and lay down new bone. When we are growing, osteoclast cells are more prolific. They are producing more bone than the osteoblast cells are breaking down. Once we stop growing, these two cells generally work in unison until perimenopause. To put it simply, estrogen acts as a regulator for osteoblast cells, the ones that eat our bone. When estrogen starts to decline or is no longer present, those osteoclast cells, the eaters, start having a party, and the osteoclast cells just can't keep up. This is why we are told at 40 to lift weights and jump, yes, like jump, up and down, to stimulate the production of osteoclast cells, the builder cells. But you have to lift heavy weights and not to exhaustion. 4 sets, 4 reps, 4 times a week. It's paramount to maintain our strength and bone density. This is why it's important for women to have a bone density scan, a DEXA scan. However, women are typically encouraged to have bone density scans at around 65. By that point, most of us, unless we're on HRT, will have been living with little to no estrogen for 15 years. Estrogen starts declining in our 40s, and we don't actually get osteoporosis tests until we're 65. If you catch it early, there are things that you can help to change, alleviate, and stop it. Finding out early is paramount for early intervention. And get this, 50% of women over the age of 65 will have bone fractures before they die. 29% of all hip fractures in someone over the age of 65 will result in death. I'm going to say that again. 29% of all hip fractures in someone over the age of 65 will result in death. And this rises to 70% if surgery is not performed. And bone fractures are not the only concern. Musculoskeletal syndrome of menopause will affect 85% of us. This includes muscular pain, joint pain, stiffness, an increase in ligament and tendon issues, bursitis, tendinitis, decreased muscle mass, and frozen shoulder. This is due to the inflammation that occurs when we don't have enough estrogen. And there is also a bone-brain axis. Bone and muscle help regulate insulin levels. Bone and muscle are everything, and we are from a generation where the goal was to be skinny, skinny, skinny. As women, we were taught not to eat enough protein. And if we don't eat enough calories or burn too many calories without replacing them, yep, you guessed it, this will have a significant effect on our bone density. Food for thought, right? And furthermore, we lose 20% of our bone density when we are breastfeeding. So make sure you're eating enough to replenish it if you're breastfeeding. However, if you've had babies in quick succession, especially later in life, get a bone density scan, as your body may not have had time to fully replenish. Actually, if you're over 40, just get one and see where you sit so you can take action before there's irreversible damage. And muscle mass is super important. It plays a huge role in muscle tissue maintenance, which is similar to that of bone remodeling. It helps muscle tissue regenerate and build. So when estrogen levels decline in menopause, your muscle tissue begins to decline too. Muscle loss can lead to decreased mobility, strength, increased fat mass, poor health, and increased risk of falls and fractures. It's imperative to keep ourselves strong. HRT has been found to have a significant positive effect on muscle mass and strength. Specifically, hormone therapy has shown to increase receptors in the muscles and improve muscle power, contractions, and composition. If you want more information on this, I strongly advise you to listen to Vonda Wright. She's an orthopedic surgeon and leading speaker on the effects of perimenopause and menopause on bone health. Then we have insulin resistance. The body's cells become less responsive to insulin, leading to higher blood sugar levels. And if your blood sugar levels remain high for an extended period of time, this can lead to chronic low-grade inflammation. And I'd like to say that insulin resistance is the first sign of metabolic dysfunction. It's also the gateway to metabolic syndrome. a group of conditions that significantly increase your chances of type 2 diabetes, coronary artery disease, and stroke. Metabolic syndrome can include elevated blood sugar levels, elevated triglycerides, low high-density lipid proteins, high cholesterol, and high blood pressure. Because our estrogen levels decline during this transition, we are more susceptible to developing insulin resistance. Estrogen and progesterone play an important role in glucose metabolism, and in their absence, this can contribute to metabolic dysfunction. So abdominal obesity, visceral fat, that muffin top, and physical inactivity are key factors in developing insulin resistance. You're also at increased risk if you have PCOS, sleep apnea, or fatty liver disease. There has been some research suggesting that hormone therapy may have protective effects against insulin resistance in postmenopausal women. In fact, according to the book The New Menopause, studies have shown that women on hormone therapy have a 20% lower chance of developing type 2 diabetes compared to those who are not using HRT. However, more research is needed in this area to confirm these findings. Let's talk suicide. Yes, ladies, our chances of suicide increase. Population-based longitudinal study of middle-aged women revealed that women who experienced the onset of menopause and perimenopause were at an increased risk of suicide. Ladies, women are committing suicide. Our brains are wired for hormones. It would be interesting to see the statistics on how many psychiatrists actually know of or acknowledge this. And are the treatment of hormones a consideration, or are we just putting women on antidepressants, antipsychotic drugs? And have these medications even been studied on the brains of perimenopausal, menopausal women who are prescribed these medications? Remember, we weren't even used in clinical trials until 1993. And for years, we were told it was literally all in our heads. Women were locked up in psychiatric wards, midlife mania coming from the ovaries. There is a need for better training, support, and public awareness. I wanted to share a story from the Menopause Society charity, as it really depicts how menopause affected the mother of two young women who are now on a mission to share their mother's story and raise awareness. They speak about their mum and how she loved to party. She was the one that was up all night on the dance floor, enjoying every second. Sounds actually a bit like my mum. She really knew how to live her life, but they first started to notice changes in their mum around a year before she died. Initially, they noticed she seemed more sensitive and was showing signs of anxiety. Then the paranoia took over her. She felt that people were against her. She thought her closest friends had started to hate her, which was not the case. They said this was the most severe change in her personality. She also had problems sleeping, which affected her mental state. And then there were physical changes too. Her appetite went, she lost weight, and she turned into a former shell of herself. They lost her to suicide. And this is not an isolated incident. Google it, perimenopausal psychosis and depression. It's a thing. Another story of a husband who lost his wife. He said that his wife felt that the close relationship she had always had with her children had disappeared, and she struggled to feel warmth and affection. She felt that she lacked empathy. All those traits that she now perceived were in fact the polar opposite of who she really was. They sought advice from specialist after specialist who continually fobbed off the suggestions that maybe it was her hormones. They diagnosed a woman with a degree from Harvard who loved her job, her family, and her life prior to perimenopause with psychosis and depression. He lost her to suicide. When a woman is in her mid to late 40s and presents with anxiety and depression, especially when she has no prior history of mental health issues, surely the first question should be, is there a link to perimenopause? Why is this not the case? Much more needs to be done to recognize and treat the problem of changing hormones on women's mental well-being. Are you feeling this way, or are you noticing these symptoms in anyone around you? Reach out for help and reach out for someone who is qualified in perimenopause and menopause. I know for many of us, we feel helpless in the search for our former selves and for a doctor who truly understands us. However, we often leave doctors' clinics disheartened and unheard. You're too young for perimenopause. Here's a handful of pills. HRT causes breast cancer. It's all in our heads, or simply every woman goes through it, so toughen up. It leaves us disenfranchised with the medical system. So, if you're a medical practitioner, check out the Debbie Grant Foundation. They have wonderful tools for medical practitioners wanting to upskill in this area. Then they also have fabulous tools for individuals too, with links to resources and practitioners. Ladies, this will be the first time in history where a majority of the female population will be living 40 years past menopause. Women undervalue themselves. Don't believe that for the next 40 years after menopause, you'll just be dying. The brain is rewiring. It no longer needs the energy required for reproduction. Utilize this opportunity. There are some sensational stories of women creating empires, running marathons. This is the time for you, but let's do it armed with good health. So, I'm going to tell you about my journey onto HRT. Yes, I'm 42, but I started to experience some symptoms that were really affecting my everyday life. Also, as you know, my mum has dementia and I carry the APO4 gene. Some of the symptoms that I was experiencing was electric shock syndrome. I was getting these little shocks. I was getting tingling. I had convinced myself that I was heading into neurological decline. I was having sleeplessness and insomnia, waking up at 2 a.m. and forgetting everything. Raging feelings. I'm happy. I'm sad again. I'm happy again. Wait, hang on, what do I feel? And then I had the inability to focus. And I was just a little bit achy, not recovering from exercise like I used to. And I felt lonely and isolated. There are 100 people at my house on a daily basis, and I felt lonely. It was like being a teenager all over again. And my pelvic floor started to betray me. A week before my period, it was out the door, and I got heavy periods. That menstrual cup, it was overflowing. Yes, thanks, ladies. I actually use one now. I was in school all over again, walking backwards, leaving meetings. And I had no interest in intimacy. My poor husband was holding out eagerly, hoping for that glisten in my eye and to look at him like I did 5 years ago or when I was pregnant, because he is looking at me the same way he always has. Navigating perimenopause is a joint journey for our partners too. My journey with hormone therapy has been very, very positive. I had forgotten what it was like to sleep. I can sleep for 4 hours after taking progesterone and still feel better than I did after sleeping 8 hours without it. I feel like me again. I'm still yelling at the kids, but now I feel it's warranted yelling, not just psychotic yelling. I'm less bloated and I'm less achy. I feel mentally stable and more so mentally strong. So strong that any of the shit comments on TikTok from men about women's hormones and vaginas, you can all F off. You're only viewing my reel because you've searched the word vagina, you dirty bastards. But my point is, I actually don't care. Whereas before, I would have been under the doona, hiding, thinking my life was over and taking their comments to heart. Now I feel like a stable midlife woman who doesn't give a shit anymore. Basically, as young girls, we were taught to read the room and not offend. As perimenopausal women and beyond, we've realized that is bollocks. Offend away, ladies. I figure after this episode, local doctors are going to be influxed with informed women wanting answers. Good, because doctors need to be informed. And if they don't want to upskill in the area of treating women over the age of 35 and their health, they should be referring us to someone who does. So what's the take home here? Now I've convinced us all that we're in first stage cognitive decline, our heart palpitations are cardiovascular disease, we're thirsty because we have a metabolic disorder, and we're going to have shonky bones because we can't jump to make them strong again because our pelvises are betraying us. I hope that we now know that perimenopause and menopause are not just hot flushes and night sweats. And we must now prioritize the prevention of osteoporosis, coronary artery disease, insulin resistance, prediabetes, neuroinflammation, visceral fat, loss of muscle, and perimenopause, depression, and psychosis is a thing. And there can be some benefits from HRT. Whether you decide to go down HRT or another route, it's important that we are all informed with the relevant and up-to-date information so that we are equipped to make health decisions based on our own individual risk versus benefit. There also needs to be more research. Why? Because our longevity depends on it. I hope you're feeling a little bit more informed on these topics, and we'll deep dive into them individually in the future. And to my husband, he is a beautiful man. We talk about these changes in hormones and what it's like for me all the time. He is also privy to a lot of vagina talk. We have 3 in our household, so he's outnumbered 3-1. He truly does try to understand, and I appreciate him for being on my side of the court with me. I mean, he does jump the net on occasions over to the other side, but he's a man, and they are not supposed to be on our side of the court living in their feminine all the time. Gav, I totally appreciate you, especially now that I'm on HRT, and I'm grateful for the comfort and security you have within yourself not to be offended when you hear this podcast. Knowledge is power, power is wisdom, and a wise vagina is an informed vagina. Till next time, my beautiful vaginas, water those lady gardens because they are worth it. Please note that this podcast is for entertainment and informational purposes only. The content shared is not intended as medical advice, diagnosis, or treatment. Always consult a qualified health provider for any medical concerns or before making any health-related decisions. The views and opinions expressed on this podcast are those of the hosts and guests and do not represent those of any medical organization or institution.